Welcome to Business Innovators Radio, featuring industry influencers and trendsetters sharing proven strategies to help you build a better life right now.
Hello, listeners. This is your host, Andy Curry, and today I am fired up because I have on the line with me Dr. Brent Chinn of Precision Eye Care out of California. Dr. Chinn did his undergrad study at Berkeley, California, is where also he did his optometry schooling for another 4 years. He and his partner, Dr. David Redman, have two locations. The first one is in Mountain View, a very highly competitive area. They started that one in 1995. The other location is in San Jose, California. That one was started in 1999. Dr. Chinn, welcome to the program.
It's great to be with you, Andy. Thank you for having me.
You're welcome. We're really happy to have you with us here. Dr. Chinn, tell us about Precision Eye Care. First of all, how did you and Dr. Redman get together? What made you go into optometry? How did your practice come about? Who do you help and that kind of thing?
Well, I think it all started for Dr. Redman and myself in optometry school, where we developed a good rapport working with each other, and I think talked about being able to practice together, being able to practice to the highest level, and really taking care of patients. And I think patient care philosophy has always been to a very high level, and so we respected that about each other. And after graduating and going our separate ways from optometry school, I found a practice in Mountain View that I felt would be a good base for a practice to sort of continue and flourish, and decided to purchase into that. I did ask Dr. Redman, hey, this is a great opportunity for us to sort of fulfill our dream of being able to practice together, and come on up and take a peek. And he was practicing in Southern California at the time, and they came on up and said, yeah, this is a great basis to kind of jump off from. And we brought the practice together, and since 1995 have practiced in the Mountain View location. And as you said, we opened up another practice in San Jose in 1999. And that's sort of how things got started. It's been a great ride. We really enjoy being able to interact with patients on a real personal basis, finding out about the problems in terms of their vision, and ultimately taking care of those issues that they have, and doing that along with our staff has been very, very gratifying over the years.
Now, when you guys started, did you buy a practice that existed? Is that what you said?
Yes, we did. We bought a practice where, unfortunately, a doctor had passed away, and interestingly, he had the same last name as me, and really? That I think really, boded well to keep patients in the practice. He had 4 sons, so I think automatically patients that were in the practice assumed that I was probably one of the sons, which turned out to be quite nice, because our retention of those patients was at a very high level. Although I did fess up that yes, I was not indeed a son when they did come in, but they all asked the same question of, yeah, are you one of the sons that you took over the practice? So yes, it was nice to buy an existing practice. It made our lives a little bit easier, because we didn't have to right away kind of scurry and try to find how to get patients in the office. They were already present and were continuing to come in.
That's neat. Boy, what an incredible coincidence. You had the same last name. You just never hear that.
Yeah.
Now, I've read some online reviews, actually a lot of them, about your practice, and you guys have tons of them, especially on Yelp. And one thing that really stood out at me was I didn't see any negative ones, and that makes me think you doctors and your staff must bend over backwards to really take care of people. So let's talk about some of the services you offer. What's the main thing? What are you really known for, first of all?
Well, I think that one practice philosophy that kind of flows from the entire staff as well as the doctors, it starts with us, is that we we do our best to make sure that when the patient comes in, that they're the focus of each and every person's attention in the course of an eye examination and a visit to our office. So, whether they're at the front desk, whether they're being seen by us in the exam room, whether they're being tested by one of our clinical assistants, that they take away from that experience that, well, that's the best, pre-test examination I've ever had. That's the best eye examination I've ever had, and that's the best, frame selection that I've ever had. So it really is a philosophy that we really hold to with all of our staff members, and they definitely are very consistent, with that. When they see us practicing sort of what we preach, I think it's really easy for them to also, sort of practice at that level. So we actually do comprehensive eye examinations, which includes, visual analysis of your prescription, a prescription for contact lenses, if that's something that we're going to go after in a patient's case. We also diagnose and treat eye diseases such as glaucoma, cataracts, macular degeneration. We don't do surgery, but we co-manage our patients that need those kinds of services, treating red eye problems like conjunctivitis, anything along those lines of eye disease. We're very proactive at treating. We are both authorized or licensed to practice to the highest level that we possibly can in the state of California, and we aim to do that. So if we have that ability to do it, we definitely treat each aspect of our patients as we are able to practice to. In addition to that, we do extensive health testing, and if there are problems, we refer those on to specialists as needed to make sure they get the care that they need outside of our office.
Is there not a test that you can do where you can check if someone has brain cancer looking at the eyes?
So there is, I alluded to a visual field or peripheral vision test that we can do, or analysis. That particular test, because of the communication pathway from the eye to the brain, there are things that can show up on those tests that can tell you if there are indeed things in the brain that we really need to be concerned about. One of those is brain cancer. I haven't personally found a cancer of the brain, but we have found pituitary cysts or pituitary gland growths that impact the vision that ultimately, if left unchecked, could result in brain damage, could result in blindness, and we have found different areas of the brain that go under duress from doing these types of tests. So it's been rewarding to be able to, find those types of results, and sometimes actually when we've referred these patients for treatment, some of the doctors have come back and say, well, we think it might be, this instead of what you're thinking it is. And we've had to actually press forward and insist that they run, a more diagnostic test. And those tests have actually come back, positive for issues that we thought were ultimately going to be very, very harmful to the patient, just by doing a simple test in the office that we do on every patient.
Now, is that an option that you give people, or is that something you do each time someone comes in?
Yeah, that is part of our comprehensive examination protocol. It is something that if you're younger, individuals, less than 8 or 9 maybe can't do it reliably, but anyone above that, we definitely screen with a peripheral vision analysis to really look for those red flags that might result in something that we've just talked about in terms of brain disorders or growths or areas that are occupied by a lesion that could really do some harm later on.
Okay, that's I'm here in Colorado. I don't think that they do that. Well, I guess that depends on the practice, but I've been to some here. Then I think it's an option. So that's neat to know that you guys do that as a comprehensive deal. That is important.
Yeah, yes, absolutely. Not every office may screen to that level, but that's something that we really believe in terms of if you have the equipment available, you should use it on every patient if you possibly can.
Yeah, because that's what you're there for, no doubt.
Exactly.
Now, you guys offer glasses, frames, and contacts.
Yes, we have a dispensary right in our office, and we, basically have a lot of different options. Sometimes people need prescriptions for just the computer. They need, prescriptions just for golf or just for reading. So we do a very good job about prescribing a specific pair of glasses for a particular need. Sometimes that results in more than one pair, but the patient ultimately is very happy, because if we try to do everything in one pair, sometimes that doesn't work out, for a given patient. So they haven't really thought about, hey, what if we, made a glass that had just for, my computer distance, and made their life much easier if they spend 8-10 hours on the computer like they do out here in Silicon Valley. And in addition to that, we have contact lens options. A lot of patients wear contacts just even socially. So if they on weekends are going out, or they're doing a recreational event like hiking or a sporting event like tennis or golf, and they want to be able to wear contacts, a lot of patients think that they have to wear them all the time. That's definitely not the case. You can wear contacts just occasionally, just for social occasions, and in addition to that, have glasses most of the time. So we have a lot of patients that do that, but we also have a lot of patients that are in contact lenses full time, and even those that don't actually think they can wear contact lenses. There are situations where people have to do reading and distance simultaneously, and they don't think you can wear contacts. You have to wear glasses. But that's not true. You can definitely take the time to work with patients to give them the options that they can actually wear contacts where they didn't even think that they could. And that's been very fulfilling as well, because patients oftentimes say, wow, you took all these visits and ultimately got me to a point where I can wear contacts all the time, where other doctors have said, no, we're not going to be able to do that. And that means a lot for us as well, because we were able to take their problem, take their sort of ultimate goal, and actually get them there. Even though it takes a little more time, if we get there, that's kind of what we're all about.
Interesting. Contacts have really come a long way. So I remember as a kid, my siblings would wear them, and if I remember correctly, they were small and hard, not flexible, and you couldn't wear them for more than 8 hours, I think. Is that how it was?
Absolutely. Yeah. Lenses in their infancy were a much harder material. Some were large, some were small. Definitely, comfort was a very consistent theme, especially if you got something into your eye. It became very, very uncomfortable. With the advent of what we call soft contact lenses, we were able to get lenses that had a lot of moisture content, so they weren't nearly as uncomfortable. And now we even have what we call disposable soft contacts, where patients can actually just wear them even as little as just one day and dispose of them without having to care for the lenses, which has been, number one, very, very healthy for the eye, but number two, just very, very convenient to care for. And those soft lenses correct, again, a myriad of solutions: nearsightedness, farsightedness. If you have astigmatism, yes, you can wear contacts. And again, I alluded to the fact that you can even do distance and near tasks at the same time with one contact lens. Those are even available as well. So yeah, soft contact lenses have really, I think, opened up a big avenue for patients who didn't think they could otherwise wear contacts, because the technology has come so far, so fast. And that's one thing that we, again, strive to let patients know about is, hey, we have these lenses available. You probably didn't even think you could wear them, but we certainly can give them a shot.
I tried wearing them once, and my eyes just watered all day long, and I just decided I couldn't do it. Maybe I should try it again someday.
Yeah. Ask your eye doctor to maybe take another look. Certainly, there are other patients that we might not be able to quite get there with, but we will definitely do our best to hopefully try everything that we possibly can to get you there. If that's a very, very high sort of lofty goal that you have. So fly out here to California and we'll take care of you.
By golly, I might take you up on that. Now, you mentioned astigmatism a little bit ago, and I know everybody asks you what that is, and so let's clear that up. What is an Is it an astigmatism, or how do you say it?
Right, it's an astigmatism. Astigmatism is a word in of itself. I know it's a very intimidating word to hear. When people hear that about their eyes, it sounds very different than farsightedness or nearsightedness. But when in fact, just like nearsightedness and farsightedness are just a condition of the eye that we can correct, astigmatism is just like that. I think the best way to think about if you have an astigmatism in your prescription is that the very front portion of the eye, when you have no astigmatism at all, is like half of a basketball. So no matter where you are on that surface, you can kind of picture what a half of a basketball looks like. It's the same sort of shape. And when you have astigmatism, the shape to think about is sort of like a half of a football. And then when you picture that in your mind, you can see that there's one area that's more curved than the other. Mm-hmm. That difference in curvature is what creates distortion. That distortion is what astigmatism correction is. And again, you can correct that very easily in glasses as well as contacts. And that distortion really creates a lot of discomfort in a lot of patients that didn't otherwise really think they had an issue. They come in to the office saying, yeah, things are just a little blurry. I can see pretty well. And a lot of times those patients can, but they don't have any nearsightedness. They don't have any farsightedness, but they do have this thing that we're talking about called astigmatism. And that correction in itself actually yields crisper, clearer vision on computers, driving, things of that nature where there's a lot of detail. So even a little bit of distortion caused by astigmatism is worthwhile correcting. So hopefully that kind of explains what an astigmatism is.
Yeah, that is. That's fascinating to me. To those of us who haven't studied like you do, for sure. Well, Dr. Chinn, thank you so much for giving us some of your time and telling us about your practice and such. Now, if people want to get a hold of you or Dr. Redman, your offices, how do they do that?
Well, there's a couple of ways, Andy. One is simply go to our website at precisioneyes.com. There you will see a listing for both of our offices, again, in Mountain View and in San Jose. If you want to call us directly, you can get a hold of us in our Mountain View office at 650-967-0140. And in our San Jose office, we can be reached at 408-362-9789. And I've really enjoyed being able to talk to you a little bit about the practice, and thank you much for your time.
Well, you betcha. Thank you.
Thanks for listening to Business Innovators Radio. To hear all episodes featuring leading industry influencers and trendsetters, visit us online at businessinnovatorsradio.com today.